On board with us this morning from Akron Children's Hospital Sports Medicine Center, our good friend Dr. Joe Concini with us. And Joe, more technology coming out in the fight against sports concussions.
Yeah, right. Sometimes we talk about things that are really routine sport-related things, and sometimes some new cutting-edge things. And there were two things in the last 2 weeks that have occurred in the battle against concussion and trying to get an upper hand in concussion. And I wanted to talk about both of these. Two have been now approved. They're looking at first of all, I'll talk about a new helmet that you'll see on the scene, I guess, next time we see football. It is called the 02 Trench Helmet, and it is the first position-specific helmet. It's made for linemen, for offensive and defensive linemen. And the way it was developed with the help of an offensive lineman from the Seattle Seahawks, they've been working on this for about 3 or 4 years. Most of the impacts for linemen are low-velocity, direct blows to the front of the helmet, and basically it occurs on every single play. Every snap, linemen the front of their helmets get the impact, and so they have kind of a deformable outer shell. The front of the helmet is kind of like a crash zone, like you would have designed in a car, and you'll see it. It is a little bit different looking than some of the other helmets that you've seen. The trench helmet has a crunch zone, and so it's been studied. Some linemen wore it. The one lineman from Seattle wore it all year last year. It got a 5-star rating from the Virginia Tech University Helmet Lab. Virginia Tech happens to be where most of the study for new helmets goes on. And so although when we think we're getting near the end of the line of safety, everybody's looking for new things. This is very unique, though, to linemen, and it is made specifically for linemen. And so we will see this year how the trench helmet works on offensive and defensive linemen in the sport of football.
And then you said, the collar?
Yeah, you and I have spoken for at least 5 years ago, maybe 6. There was a thing called the Q collar, and it was being studied by our friends down at Cincinnati Children's. We're working on a couple studies with them now. But this has been kind of their baby for a while. They've been looking at this collar, and it is a hard C-shaped collar that goes around the neck of any athlete playing high-impact sports that could be at risk for concussion, and it puts a small amount of pressure on the jugular vein to keep some of that blood in the brain, to keep the brain from moving around. The slosh effect, they call it, that when people get hit and the brain moving around in the skull, in the cranial vault, is really what a lot of people think leads to some of the damage that leads to concussions. And so by having some fluid that remains in the jugular veins, it helps reduce the amount of movement. And the way they know this, they didn't look just at the number of concussions. They actually looked at a very fancy type of MRI called an Fmri, and there is a type of damage to a part of the most important part of the brain, the white matter of the brain, and they looked at people that wore it for a whole season, the Q collar, and those that didn't wear it. That was their first study back about 5 years ago. I believe it was Cincinnati Moeller and Cincinnati Xavier down at Cincinnati, and they looked at it. And since then, they have been continuing to do studies. This study's gone on 5 years, $30 million they put into the development, and 3 days ago they got FDA approval proving that there is some amount of decreased trauma to the brain by using this Q collar when you're playing any contact or impact sports. And it's just released very recently ago. And I think one of the things they're basing a lot of the evidence of it working is the fMRI data, the MRI data that shows decrease of these different bruising, if you will, to the white matter of the brain in those who wore it versus those who did not wear it in multiple different sports. Long-time study. It takes a long time to get these things out there. People have been wearing them beforehand. You might have seen Luke Kuechly when he was going through his struggles. He's from the Cincinnati area and knew the people at Cincinnati Children's. He's kind of become the spokesman for this. and talking about how well it worked in his career. At the end of his career, he was using the Q collar, and people have been using it intermittently the last few years, but now we may see a lot more of this interesting-looking rigid collar around the neck of athletes that play impact sports called the Q collar, because it's been released today by the FDA as being beneficial for head trauma.
Well, I'll bet we see a lot of it starting next season, that's for sure. Joe, great insight again, my friend. Thank you for taking the time to educate us, and look forward to reconvening next Wednesday morning. Thank you.
That sounds great, Ray. Have a great week.
You as well. Dr. Joe Congini, good insight into the world of sports medicine from Akron Children's Hospital Sports Medicine Center, here weekly, Wednesdays on WAKR.